Okay, today we're talking about Chapter 7, Other Addictions and Other Drugs. We're only going to cover about half the chapter today. And let me see, there we go. Okay, we're only going to cover half the chapter today, so there you go. First thing we're going to talk about are inhalants. Inhalants include volatile liquids, aerosol sprays, gases that come in pressurized tanks. These substances have many of the same psychoactive effects of street drugs. Inhalants do. We're going to talk about sports drugs, natural and synthetic substances. They accelerate the healing of injuries, they increase performance, and they alter the state of the athlete's consciousness. We're going to talk about hard to classify drugs such as animal extracts, herbal preparations, smart drugs and drinks, and nootropics. They've been used for their psychoactive effects. They've been used to improve mental health. They have been used to improve physical health. So the first thing we're going to talk about are inhalants. Inhalants are used because the user finds it stupefying, they find it intoxicating, and occasionally they find it psychedelic. There are three main groups of inhalants: volatile solvents and aerosols, volatile nitrites, and anesthetics. Most of the volatile solvents and aerosols are synthesized from petroleum and mixed with other chemicals. Hydrocarbons are found in glues, gasoline, nail polish remover. Many aerosols are inhaled for their propellants rather than their ascribed contents. Other volatile organic compounds include esters, ketones, alcohols, and glycols. The volatile nitrites include butyl and amyl nitrite. These drugs are used as vasodilators for people with heart problems. They have also been used as air fresheners. Illicitly, they are used recreationally at parties, but especially in sexual situations. And we'll explain those sexual situations in just a moment. These are what they call poppers, and that's why they're up here. And this is the illicit stuff that we were talking about. Anesthetics are used to block pain or induce unconsciousness for medical procedures. Nitrous oxide is used in dentistry for anxious patients who do not wish to use Novocaine. Also called laughing gas, it is not uncommonly used at parties to induce giddiness and euphoria. And what these two young ladies are doing, they have balloons that are filled with nitrous oxide and they are sucking it down their throat. Now, nitrous oxide will only last for a couple minutes and it gives you a euphoric effect, but for a party you can see how happy this guy is. And he's taking something into his mouth. I'm not exactly sure what that is. It may be a connector to a nitrous oxide container. I'm not really sure. What is their secret something? Secret Santa? Anyway, oh, that's what I was trying to read her label here. It looks like Secret Santa. I guess they got nitrous oxide for Christmas. The most widely used inhalants are nitrous oxide, nitrites, gasoline, glue, spray paint, aerosol sprays, lacquer thinner, and correction fluid. And there you go. You can even snort Sharpies. Inhalants are sought because they are quick acting with intense effects. They enter the bloodstream within 7 to 10 seconds, and they may last for a few minutes to an hour. They are cheap, readily available, and widespread. There are more than 1,500 chemical products that can be inhaled for their psychoactive effects. They are readily accessible to children and adolescents, as many exist in any garage or home. They have more direct toxic effects on body tissue. There is a lack of awareness of inhalants as drug problems. Inhalant abuse is most prevalent among adolescents. Inhalants account for from 700 to 1,200 deaths in the U.S. per year. I tried to look up to see how many we had last year, but the last figure I could get was 2006, as weird as that is, and there were around 1,200 deaths. This is a worldwide problem as cheap highs are sought by the young, the poor, the street children, recent migrants to cities, indigenous peoples, and children of parents who work at home with volatile chemicals. The inhalant of choice in many poor countries is gasoline because of its availability. Inhalants are most likely abused by 12 to 17-year-olds and more females than males. This problem was especially serious in the 1990s, but has since dissipated. American Indian and white adolescents are more likely to use inhalants than blacks or Asians. There are 7 methods of using: sniffing, breathing in the inhalant through the nose directly from the container; huffing, soaking material and putting the material over the mouth and nose; bagging, soaking material and placing the material in a bag to be inhaled through the nose or mouth; spraying the inhalant directly into the nose or mouth; balloons and crackers, puncturing a can of inhalant and capturing it in a balloon for inhaling. And that's what you saw those 2 young ladies doing. Masking, spraying an aerosol in a bag and then putting the bag over your head, and then just putting it on your clothing. Working in the emergency room, I have seen all of these. Usually it causes a problem. Well, if it's on their clothes when they come in, you can catch it as soon as they walk in the door. But all of these are fairly obvious if they come in with a problem. Volatile solvents are carbon and hydrocarbon-based compounds that turn to gas at room temperature. Gasoline, gasoline additives, paints, especially metallic paints, kerosene, air dusters, paint thinners, lacquers, nail polish remover, spot removers, glues, and plastic cements, and lighter fluid. When I was young, we used to use nail polish remover to kill insects so that we could mount them for entomology. I was a member of the 4-H, and I was in entomology, and that's how we kill them. We kill them with nail polish remover. Makes you wonder about your sister who's putting on nail polish and then taking it off, and putting on nail polish and taking it off. Those are all solvents. Volatile solvents are absorbed very rapidly into the blood and move to the brain, the heart, and liver within 7 to 10 seconds. You get a temporary stimulation. It elevates your mood. It reduces inhibitions. It makes you impulsive. It makes you excited, irritable, dizzy, slurred speech, unsteady gait, and it makes you sleepy. These inhalants are exhaled by the lungs and excreted by the kidneys. After prolonged inhalation, the user may experience delirium with confusion, psychomotor clumsiness, emotional instability, impaired thinking, and potentially coma. Long-term effects of inhalant use: arrhythmias and myocarditis, pulmonary hypertension, respiratory distress and lowered breathing capacity, liver toxicity. Carboxyhemoglobin may cause brain damage. Some inhalants may cause neonatal growth retardation, odd facial features, and tremors in newborns. While most huffers move on to other drugs, those who stay with inhalants can expect some fairly debilitating effects: poor coordination characteristics, inability to concentrate, weakness, disorientation, weight loss, memory loss due to hippocampal interference, poor problem solving, difficulty controlling one's behavior, blood irregularities, and chromosomal damage. Chronic huffers tend to have antisocial personality disorder, but it is not sure whether the huffing causes the behavior or the environment that they choose to live in. These individuals also tend to use whatever drugs they come across as they come across them. The most widely abused substance is toluene or methylbenzene because it is such a good accelerant and is in so many products. It's in glue, drying agents, solvents, thinners, paints, inks, cleaning agents. 65% of chronic abusers of toluene have neurological damage, and that's good news, I guess, or not good news. Toluene and benzene, the huffer's high. There you go. That's the way to do it. The trichloroethylene, or TCE, is another common solvent found in substances used for huffing. Correction fluid, paints, metal degreasers, spot removers, extracting oils and fats from vegetables. This is penetrating oil, and it has TCE in it. And that's trilene that they use to knock people out. It's used as an anesthetic. It causes depression and moderate hallucinations. If used heavily, it can cause neuropathy. Some of these neuropathies can be permanent. That's not good news for you. This is Alice Chalmers penetrating oil, and it's got TCE in it. N-hexane and methylbutyl ketone are solvents used for glues, solvents used for adhesives, diluents for plastics, diluents for rubber, in the production of laminated products, as a paint thinner, as a solvent for dyes. N-hexane and MBK have been shown to cause neurological damage, especially in the brain. Recovery can take up to 3 years. Small molecule alkanes are gaseous at room temperature and cause cardiac arrhythmias and sudden death, and include methane, ethane, butane, propane. Large molecule alkanes are also neurotoxic and include hexane and pentane. We used to live in Montana, and one of the groups up there, one of the religious groups up there, are a group called the Heuterites. The Heuterites live in colonies. They live in small villages, and each village will produce their specialty. Some of them produce pigs, pork, and pork products, and sausage and whatnot. Some produce chickens, some grow corn, some have milk cows. And what they'll do, they'll trade the chickens for milk and chickens for the pork products. They'll trade them back and forth. So each colony has a specialty. Well, the colony that raised pigs, this is on the other side of Havre, Montana. They raised pigs, and so they had this huge operation with lots and lots of pigs. And they'd butcher them, and of course then they'd sell the meat and whatnot. But the biggest problem they had was pig manure. And what do you do with pig manure? Well, pig manure is fairly rich, so you can use it as fertilizer. So what they would do, they had a concrete pit, and what they would do, they would scrape the pig manure down into the pit. But of course, they never went down into the pit because, well, it was kind of dangerous. And one day they found out exactly how dangerous it was. The wind was blowing, and the wind was blowing, and it was blowing so that it kept the methane in. So the methane wouldn't come out because of the shape of the structure, and the fact that the wind was keeping it in, and it wasn't able to dissipate. So on this given day, there was a guy that was cleaning out. A guy and his wife were out there cleaning out cleaning the pig manure, and they were shoveling it into the pit. And pig manure sometimes is very slick, and that's what happened. He was shoving some, and he was getting moving, and his foot hit a slick spot, and he slid, and he fell into the pig manure. And his wife, knowing that pig manure is dangerous, she bent down to pull him out, and they both died. They both died of methane poisoning because pig manure, well, it produces methane. And both of them died, and they said, well, he was dead before he hit the ground because the methane had just replaced all of the oxygen in his body, and he was gone, and so was she. As soon as she leaned down into the pit and breathed the methane in, she took in enough methane to kill her, and by golly, that was it. As weird as that sounds. So be careful of methane. Gasoline is readily available and used as an inhalant, especially on American Indian reservations. I don't know that it's that prevalent in the Southwest, but it's certainly prevalent in South Dakota, North Dakota, Montana, and Washington State. The effect only lasts for 3 to 5 minutes. Not only are the hydrocarbons neurotoxic, but the solvents, metals, and additives can cause problems as well. Insomnia, tremors, anorexia, paralysis, lead poisoning, brain, liver, bone marrow, kidney, and lung damage. Residual effects might last for 5 to 6 hours. Over half of all inhalant deaths are due to gasoline inhaling because it is so prevalent. And of course, you can see this guy has burned himself. And here's a lady that is sniffing gasoline out of the can. Alcohols are the most frequently abused inhalant solvents. Methanol, ethanol, and isopropanol. When inhaled, alcohols can produce a mild high along with nausea, vertigo, weakness, vomiting, headaches, and abdominal cramping. And of course, this is really quite dangerous. It's a good way to damage yourself. And he's doing it, and this guy's doing it. Not the best thing in the world. For emergency room personnel, it is important to know the warning signs of solvent abuse, and I've seen all of these working in the emergency room. Headaches, chemical odor on the body or clothes. Oh man, I'll tell you, what a smell. Red, glassy, or watery eyes with dilated pupils, nosebleeds, inflamed nose, rashes around the nose or mouth, slow, thick, or slurred speech, staggering gait, disorientation, lack of coordination, pains in the chest and stomach, fatigue, nausea, shortness of breath, loss of appetite, intoxication, irritability and aggression, seizure and coma. One of the first things that we look for when somebody comes in and they seem to be fairly disoriented is we look for red areas, especially around their faces, their noses. Do they have pimples around their mouths? These are all indicators that the individual may be a huffer. Nitrites have been used as medicines, especially heart stimulators, for angina since the 19th century. Alkyl nitrite, isomyl nitrite, butyl nitrite, isobutyl nitrite, isopropyl nitrite, and cyclohexyl nitrite are all nitrites. And this is an inhalant. This is from World War I, actually. And they would put it under somebody's nose as a stimulator to get their heart beating again. Nitrites dilate, so if you've ever watched a movie where where they were popping something under somebody's nose, it may potentially have been one of these things, especially if it was an old movie. We stopped using these when I was working in the hospital. If somebody passed out, we had another type of an alcohol and ammonia, and we would pop these things and get them and put it under their nose to bring them back around. Nitrites dilate blood vessels so that organs, probably were killing them ourselves with the ammonia. Nitrites dilate blood vessels so that organs can receive more blood. This is usually done for the heart during angina attacks or with cyanide poisoning. It takes 7 to 10 seconds for the effects to take place and lasts for 60 to 70 seconds. The blood pressure lowers, it hits its apogee at 30 seconds, and returns to normal at 90 seconds. Nitrites are sometimes called poppers. We talked about that before. Nitrites cause a feeling of fullness in the head, a rush, a mild euphoria, dizziness, and giddiness. As the inhalant burns off, they might experience headache, nausea, vomiting, and chills. Excessive abuse may cause oxygen deprivation, fainting, or passing out, temporary asphyxia. Overdoses do occur and necessitate taking the victim away from the nitrite. CPR might be necessary to maintain heart rhythm and respiration. Chronic users will have a reduced oxygen carrying capacity due to methemoglobin. Sorry, I was getting a drink. Nitrites are used to enhance sexual activity by increasing blood flow to sexual parts and relaxation of smooth muscles. This is especially necessary when the anal sphincter requires relaxation during anal intercourse. Unfortunately, nitrites impair the immune system by inhibiting the functioning of the white cells. Nitrites also convert to nitrosamines, which are cancer-causing chemicals. Poppers, when used with Viagra, cause lowered blood pressure in users, since both medications lower the blood pressure. When these two drugs are used with methamphetamine, people have been known to faint or even die. Volatile nitrite abusers are notorious for multiple drug use. 2/3 use at least 3 other inhalants. 1/3 abuse alcohol. 1/3 abuse drugs other than inhalants. Anesthetics are used to slow the central nervous system and stop pain from reaching the brain. Anesthetics also cause euphoric effects when abused. One of the first anesthetics to be abused was nitrous oxide that we've talked about before. Recently, nitrous oxide has been abused along with ecstasy to accelerate the rush and to enhance the effects. Nitrous oxide is sold in small plastic canisters to be used in cooking. And there you go. That's how you make cream, whipped cream, is with nitrous oxide. Nitrous oxide effects, and this is one of the reasons why people shoot Ready Whip into their mouth. It's got nitrous oxide in it. That's the accelerant that is used. They didn't use nitrous oxide. If they used something else, it wouldn't taste as good. So people shoot that stuff into their mouth. Nitrous oxide effects include dizziness, giddiness, and disorientation, silly laughter, buzzing and throbbing in the ears, visual hallucinations, confusion and headache, feeling that one is about to pass out, impaired motor skills, and fainting. The effects only last 2 to 3 minutes. Cognitive functioning is impaired with the drug, but returns to normal after 5 minutes. Long-term exposure can cause peripheral and central nerve cell damage due to lack of oxygen. Nitrous oxide replaces oxygen in the blood. Long-term exposure will lead to loss of balance, loss of dexterity, overall weakness, numbness in the arms and the legs, cardiac arrhythmias, asphyxia, seizures, and potentially death. And we'll watch this guy's head float up into the clouds. There we go. Okay. Halothane is rarely used in the West. It is widely used in third world countries because it is inexpensive and works very rapidly. This anesthetic is used primarily in veterinary procedures. It is most frequently abused by hospital personnel. Inhalants cause less physical and psychological dependence than other depressants. Inhalants cause cognitive impairments that hinder comprehension and recovery. Inhalants will sometimes cause a cross-tolerance to other depressants, especially alcohol, if used chronically. Inhalants are seen as low class among the drug-using community. Sports drugs. 3 categories of drugs are used in sports. Therapeutic drugs used for specific medical problems and administered through proper medical supervision, such as analgesics that take pain away, muscle relaxants that allow they relax the muscles, anti-inflammatories, and asthma medications. Ergogenic drugs, performance-enhancing drugs, include steroids, human growth hormone, blood doping, and other stimulants. And then there are recreational and mood-altering drugs that athletes use as well. Athletes use drugs because they perceive drugs as a quick way to put on pounds and muscle. It increases stamina. It gets them up for a game. It relieves their pain to keep up with other athletes who also use drugs. And this is one of the things that we saw in baseball. The pitchers started... There's been an argument in baseball about, how do you win a baseball game? Is it the hitter or is it the pitcher? They have given the pitcher advantage by raising the pitcher's mound. They moved it back because the hitters couldn't hit the ball, so they moved the pitcher's mound back. Then they raised the pitcher's mound because everybody was hitting the pitchers. They keep doing things. They changed the baseball. In the beginning of baseball, they were allowed to spit on it or put grease on it and throw all kinds of wild pitches. Then they banned all that, and it's been this constant battle between pitchers and hitters in baseball. So in the 1980s, 1970s and 1980s, a lot of people were taking amphetamines. And of course that gave whoever was taking the amphetamines, it gave them a huge advantage. So people started doing things like taking steroids to try to speed themselves up. Steroids at the time were not illegal, so they started using steroids and muscling up. And so all of a sudden, in the late 1990s, they had become so sophisticated that they started hitting the ball out of the park over and over and over again. It first started with Mark McGwire and Sammy Sosa. But before that, Mark McGwire was using steroids with Jose Canseco when he played for Oakland. And then, of course, he was traded from Oakland to St. Louis. And at that point, he became he started hitting home runs at really prodigious rates. The record was 60 forever, and then Roger Maris broke it in 1961, and he hit 61 home runs. And then Sammy Sosa and Mark McGwire started hitting home runs, and they passed 60, and they still had time to go. This is in 1999, and eventually, of course, Mark McGwire hit 70, I think, or 72, and Sammy Sosa hit 69 home runs that year. Anyway, and then Barry Bonds came along. Barry Bonds got jealous, and he's trying to keep up with the other athletes. He started taking steroids too, and he hit 75 or 76 home runs. I'm not sure. I can't remember. I'm a baseball fan. I can't remember. Analgesics and anesthetics are used to deaden pain and include both topical and oral forms of analgesics. The topicals include alcohol, ethanol, and methanol, procaine and lidocaine. Oral analgesics and anesthetics, aspirin, ibuprofen, acetaminophen, hydrocodone, also known as Vicodin, meperidine, which is also known as Demerol, morphine coating, propoxyphene, which is also known as Darvon. And I've got a picture of what a Vicodin tablet looks like. The biggest problem with analgesics and anesthetics is that they take away the pain without repairing the damage. And this can be a really serious problem because if you take away the pain, then the guy goes out and he plays, and then he damages himself even worse, or she, whichever the case may be. So they pull a muscle, and now they pulled it away from the bone. And this is a really serious problem. This is one of the reasons why you should never use analgesics before you go lift or before you do something, because it may mask the damage that you're doing to yourself. Muscle relaxants are drugs that depress the neural activity within skeletal muscles and are used to treat muscle strains, ligament strains, muscle spasms, tremors, or shaking. Carisoprodol, or also known as Soma and Vanadom, methocarbamol, also known as Robaxin, the benzodiazepines, diazepam, clonazepam, and chlorodiazepoxide, also known as Valium, Klonopin, and Librium. These are all benzodiazepines that they use to control muscle spasms. And I have a bottle of carisoprodol. Anti-inflammatory drugs lessen pain as well as control inflammation. These drugs come in two classes: non-steroidal anti-inflammatory drugs, also known as NSAIDs, and corticosteroids. Aspirin, ibuprofen, indomethacin, phenylbutazone, Solendac, and celecoxib, also known as Celebrex. Celebrex is fairly famous. Clinaril, butazolidine, and Indocin. These are all names that if you've worked around medicine, you've heard these names before. And then the corticosteroids, prednisone and cortisone. Both types of anti-inflammatories have their problems. NSAIDs, aspirin and ibuprofen, ibuprofen cause ulcers and kidney problems. Celebrex is only recommended for arthritis and may cause heart and gastrointestinal problems. Corticosteroids can cause water retention, bone thinning, muscle and tendon weakness, delayed skin healing, vertigo, headaches, glaucoma, psychosis at high doses. And these are some serious problems. Wow, that guy really blew up, didn't he? That's probably creatine powder, I think. Oops, I'm sorry. Asthma medications, wait a minute. Yeah. Asthma medications open air passages. 10% of the general population, 10% of the general population have asthma. That means that if we lined up any 10 people, one of them would have asthma. It's mostly males. Females have it as well, but it's more prevalent in males. Asthma is often aggravated by heavy exercise and stress. Exercise-induced asthma occurs in 11 to 23% of athletes. Most asthma medications used by athletes are beta-2 agonists, clenbuterol banned during competition, and albuterol. These medications increase muscle energy and growth, and I would guess that this is Leonard. That's not a real situation, but I'm guessing he takes albuterol. Ergogenic drugs include anabolic steroids, stimulants, human growth hormone, pre-steroids, beta blockers, and erythropoietin. Ergogenic techniques include blood doping, soda doping, herbal medicines, and weight loss. Anabolic steroids are synthetic androgens and are used for muscle building and muscle repair. These drugs are used routinely in medicine to treat testosterone insufficiency, delayed puberty, wasting diseases, osteoporosis, certain types of anemia, some breast cancers, and endometriosis. Now, you may wonder how in the world do steroids work and why in the world are people able to get so large? Well, the answer is if you use steroids, if you don't use steroids, it takes a couple days for your muscles to repair. But if you use steroids, then you can lift the next day. Your muscles repair very rapidly. Now there is a price that you pay. It depletes your immune system, and there are other problems that we'll talk about right now. When athletes take steroids, they experience increased body weight, lean muscle mass, muscular strength. Their stamina is increased. They become more aggressive, and that they become more confident. Athletes taking anabolic steroids will take 20 to 200 times the prescribed daily dosage, and that's one of the reasons. But this guy's so big, and that guy's so big, and those guys are so big. No, Leonard's not so big, but this guy is. Okay. Anabolic steroid users will use the drugs in from 4 to 18-week cycles. This is done to give the body a chance to recover from the drug use or to escape detection of use. Cycling steroids usually involves using more than one kind of drug. 82% of cyclers cycle 3 or more different steroids at a time. 30% use 7 or more steroids. There's a real science to this, and of course they worked on this in Eastern Europe and in Russia, where they were trying to build athletes so that they could win Olympic Games. But bodybuilders in the United States, this is a real science that they get into. This is one of the things they talk about. This is one of the things they don't talk about. Immediate effects of steroid use is increased muscle mass and improved muscle tone. That's one of the things they talk about. Having muscles too large and strong for the bone and tendon structure may cause an overstressing of the muscle, ruptured tendons, damaged ligaments. Once upon a time, my daughter had a roommate who was a bodybuilder, and she kept asking. My daughter's a weightlifting coach. She went to the University of Nebraska back when the University of Nebraska was lifting more weights than anybody else. So she learned how to teach people how to lift weights. Anyway, So she this guy was her roommate, and she kept asking him if he used steroids, and he said, no, 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 I'm clean, I'm pure, that kind of thing. Then one day he came back from the gym with a torn pectoralis muscle, which is an almost impossible muscle to tear if you are just lifting weights. But he was lifting way more. Now, normally he wouldn't have been able to lift it. If it's too much for you to lift, you just can't do it, and that's the end of it. But somebody on steroids, of course, they got lots of strange things going for them. Over aggressive confidence, their stamina is higher, their muscle strength is more, and he tore his pectoralis muscle, and at that point she knew that he was using steroids. Because otherwise he just wouldn't have been able to do it. Users often complain of feeling bloated, water retention. Anabolic steroids suppress the natural production of testosterone. We see enlarged breast, nipple changes, decreased size of sexual organs, impaired sexual function, cystic acne growth, thinning hair, and more rapid balding. So it's anybody that's an athlete that is bald, you might ask yourself, well, look at their muscles. Do you think maybe they're on steroids? If they've ever torn a muscle away from a bone, then that's a good indication that probably they were stressing it so much that they ripped the muscle away from the bone. We see this in athletes from time to time. Ken Griffey Jr., when he was playing for Cincinnati, the first year he was playing for Cincinnati, he tore a hamstring muscle away from the bone. At that stage, everybody went, yeah, he's using steroids. But at the time, of course, it was not illegal, and you could do that. But he tore a muscle away from the bone, and it took him a while to recover. And there's, of course, somebody that's probably on steroids as well. Female athletes also use anabolic steroids for muscle growth and other masculinizing effects, though some are unwanted. Increased facial hair, decreased breast size, lowered voice, clitoral enlargement, cystic acne growth, and thinning hair. Most of these masculinizing effects are irreversible. I'm going to show you some before and after pictures of young females. Now, what I want you to look at is the hair on top of their head. It's the only hair you can see, actually. There we go. And you tell me if their hair looks thinner. I can't see the top of her head. That's a little weird. This lady, it's fairly obvious. Her hair is thinner. The next one is even worse. There you go, yeah. Nice luxuriant hair on the left and balding hair on the right. She certainly looks a lot more masculine. Anabolic steroid increase the cholesterol of the user, especially the bad cholesterol, LDL. At the same time, steroids lower the good cholesterol, or HDL. Steroid users have an uncommon amount of cardiovascular problems, hypertension, thrombosis, cardiomyopathy. Because steroids encourage cell growth, they may equally encourage cancerous cell growth. One of the problems that we see a lot with bodybuilders, especially bodybuilders who have tried to continue to take steroids into their middle-age years, they don't make it that far. They blow out their kidneys, they blow out their livers, they have a heart attack, and they die. Anabolic steroids do have an impact on the user's mental state, at first supporting more aggressive and confident behavior. As use continues, confidence swings to aggressiveness, to emotional instability, to rage, to hypomania, mania, to depression, to psychotic symptoms, to paranoia. This emotional cycling is known as Roid Rage. It is more pronounced in individuals who have anger issues. This is a Nebraska football story. Their linemen were big, and their linemen were really strong. And people were accusing them of steroid usage, and of course, every time they checked them to make sure or to find out if they had used steroids, they were negative, miraculously. So my daughter was working at a restaurant in downtown Lincoln as a waitress, and one night one of the linemen came in, and he was acting really erratically, and he was yelling in the back room, and they kept moving him farther and farther back, and finally he just went tearing through the place, ripping his clothes off, and so he runs out of the restaurant and starts running down the road. All the time he's pulling his clothes off. He's it's the Incredible Hulk look is taking place, and he's running down, and they were not that far away from a residential area, and he ran down to the river, and he ran down to the residential area, and so he's running down a street on the residential area. He doesn't have any clothes on at this point. He has taken off all of his clothes, and he's just bellowing. So he's running down the street. This lady's coming toward him. She's been jogging. She's got a small dog. And he sees her, and he makes a beeline for her. He grabs her. The dog starts biting his ankle. He grabs the dog, breaks its neck, throws it into a car, broke the car window, and the dog goes into the car. So he grabs the lady, starts tearing her clothes off, and starts running to the door and trying to knock the door down. About this time, of course, people have been following him and have been chasing him, but of course nobody has been able to catch him. I guess everybody's afraid at this point. So they finally catch him, and somebody has called the police. And the police show up, and this guy's he's torn all this lady's clothes off, and he's trying to have intercourse with her, and people are pulling him off, and he's hitting them, and he damages 5 or 6 people, and finally the police tase him, and they were able to subdue him. And of course he's on the Nebraska football team. And the Nebraska football team is fighting for first place, and nobody wants to say anything because it's Lincoln, and football is king there. But of course, eventually, and they took him to the middle ward rather than charge him with anything. They took him to the middle ward, and he had a psychotic episode. What he was bellowing, or what he was yelling, were these crazy things about how people are after him, and he can't trust anybody, that kind of thing. Anyway, the last we heard, actually my daughter left not too long after that, but the last we heard, he was still in the middle ward, and he wasn't playing football after that. Anyway, this is known as a Roid Rage. This emotional cycling that they go through. And it's usually more pronounced in people with anger issues, so real dangerous stuff. While some people report a slight euphoria when taking anabolic steroids, it is thought by researchers that this is due to anticipation of intense activity rather than actual addiction. Some users do report withdrawal symptoms, and in fact, some users will use low doses during cycling to maintain sanity. There is some animal study evidence that steroid use is addictive. Stimulants are taken by athletes to make them more alert, to make them feel more confident, and to make them stronger. Much of the increase in ability when taking amphetamines is increased focus and aggressiveness. Heavy usage can lead to blood pressure problems, exhaustion, and malnutrition. Caffeine is a mild stimulant used by some athletes. At low doses, it increases wakefulness, mental alertness, slightly increases your endurance, muscle contraction, digestive disturbances, urine output causes dehydration because of the excess use of caffeine. Ephedra or mahuang and ephedrine are mild stimulants used by some athletes. These substances are were found in many over-the-counter medicines. Not everyone is sensitive to these medications, but to those who are, they cause jitteriness, anxiety, headaches, high blood pressure, cardiac arrhythmia, poor digestion, and overheating. This is a picture of his name. Last name was Bechler, Bechler. He had been taking Ephedra to lose weight, and he suffered from overheating when he was in, where was he? Was he in Florida? Yeah, he was in Florida. And he died. He died. He was a pitcher for the Baltimore Orioles, and he died of Ephedra. And of course, people were arguing, well, he just had a heat stroke. That's what he died from. He didn't die from drug use. But the reality was, the stuff was in his system, and it caused him to overheat. It was very warm that day. He wasn't sweating, and he died. And this is a picture of them carting him off the field. He died 10 days later, so he's still alive at this point. Chewing tobacco used to be a mainstay in Major League Baseball parks from the beginning of baseball until into the 1980s. Many, if not most, baseball players maintained a chaw of tobacco in their cheeks almost constantly during a game. Many baseball icons of the past died of throat or esophageal cancer. It is rarely seen today. As a matter of fact, it's outlawed in baseball now. So you can't use chewing tobacco. It's not good for the kids. And this is a picture of Nellie Fox. He was notorious for having a big chaw. He died of esophageal cancer. This is Pablo Sandoval. He used to play for the Giants. I think he was signed by the Braves, but I don't know that he's on their team. I don't know who won last night, the Dodgers or the Braves. Anyway, he used to dip snuff, and he was fairly notorious for having this stuff. Of course, he doesn't do it anymore because it's against the law. It's against the rules in baseball now. But as you can see, he's got snuff, and Nellie Fox had a big chaw of tobacco. Human growth hormone is a hormone produced by the pituitary gland to stimulate growth in children. It is prescribed for children who are of unusually small stature to stimulate growth, and for people with wasting diseases like AIDS to build strength. It is used by athletes because it increases muscle mass, skin thickness, connective tissue and muscles, acromegaly, cardiovascular disease, decreased sexual desire, goiter, menstrual disorders and impotence, decreases your lifespan up to 20 years. There's a reason why I have a picture of Ryan Braun on this page. He was caught using HGH. He was the most valuable player. He's the MVP one year, and it was the next year that they caught him using HGH. But he didn't lose his MVP award. Anyway, he plays for the Milwaukee Brewers. This is what acromegaly looks like. These individuals tend to die young. They have an elongated jaw. It's a genetic. It can be a genetic disease. Too much HGH, of course, can cause the same problem, the acromegaly. It elongates their fingers. It is thought that Abraham Lincoln had acromegaly, and that was the reason why he was so strange looking. Anyway, this is what acromegaly looks like. These individuals tend to die of a heart disease. Very common. Not that common, I'm sorry. Androstenedione, or andro, and dehydroepiandrosterone, or DHEA, are natural hormone precursors to testosterone. Neither of these supplements have been found to do more than increase your testosterone level in men with abnormally low testosterone levels. They also seem to increase HDLs and female hormone estradiol, so potentially they cause the male to become more female. Beta blockers are medications prescribed to lower blood pressure to decrease your heart rate. to prevent arrhythmias, to reduce eye pressure. They work by blocking adrenaline from exciting the heart. They also calm the individual by blocking nerve cells in the brain. Beta blockers are used by athletes who require precision and concentration, like archers, participants in rifle shooting competitions, ski jumpers, and divers. And there you go. These, oops, I'm sorry. These are the beta blockers: metoprolol, atenolol, nebivolol, bisoprolol, acebutolol, beta-zolol, and esmolol. There you go. They are, not sure what man-bait means. Beta blockers do have their problems as they cause fatigue, lethargy, dangerously low blood pressure, gastritis, occasional nausea, vomiting, temporary impotence. They may intensify your asthma. They may intensify heart problems that may kill the user. This is for people who are taking it and it's not prescribed for them. I take metoprolol, and that's because I've had a heart attack and they're trying to control my blood pressure. And of course, it's prescribed by my doctor, so I don't have any of these problems. Erythropoietin, or EPO, is a medication that is given to individuals to promote red blood cell production. It is often given to individuals who are going through chemotherapy to induce their bone marrow to produce and replacement red blood cells due to their problem. EPO is used by athletes to increase stamina, though this unnatural thickening of the blood can lead to blood clots, which in turn might lead to strokes or heart attacks. My sister died of cancer. She was on chemotherapy, and while she was on chemotherapy, she became quite anemic, and they kept giving her shots of EPO. You can't give people too much of this stuff, or it can cause blood clots. But every time she took an EPO shot, of course, she'd start producing more red cells, and she'd feel so much better because she was anemic otherwise. As it turned out, it didn't turn out well. She died of cancer, but while she was on chemotherapy and when she was anemic, and they gave her a shot of EPO, she really felt a lot better. Similar problem is blood doping, where the athlete stores their own blood prior to competition and then are administered the packed red blood cells to increase the stamina of the individual. This technique is used in endurance sports such as cycling, long-distance running, and cross-country skiing, and that's what this is. This guy is getting a unit. This is a unit of blood. It's his blood, so he doesn't have to worry about cross-matching it, and he's getting it. It's going back into his body, so that he has more red blood cells. Athletes will use just about any substance that will give them a competitive edge: herbs, animal extracts, vitamins, minerals, proteins. Unfortunately, some of these items may contain banned chemicals and cause the athlete a great deal of trouble. One dietary supplement used by athletes is creatine. Creatine is an amino acid that occurs naturally in the human body as well as in fish and meats. Creatine is used because it delays muscle fatigue. It stores energy that can be used in short bursts. It extends the amount of time a person can work out. It helps muscles recover faster. Problems come when it is overused. Dehydration, stomach cramps, nausea and diarrhea, muscle pulls and strains, and kidney problems. And also I have witnessed people that are on creatine. They seem to be fairly grouchy, and they tend to have a rage problem. So there you go. This guy, this is one day before he started using the creatine. There he is 6 days later. As you can see, he's much larger. Gamma hydroxybutyrate, or GHB, was used in the 1980s and early 1990s as a fat burner, as an anabolic agent, as a sleep aid, as a muscle definer, as a plant growth supplement, and as a psychedelic. It was picked up by sexual predators as a date rape drug, and it is now only used legally as a medication for muscle weakness. And here's a guy dropping GHB into somebody's drink. Can't trust anybody. Some athletes will consume sodium bicarbonate 30 minutes prior to exercising to decrease the development of acidosis. This works for shorter events that take place within 10 minutes, but not for longer endurance events. It can cause diarrhea and water retention. Seems like a silly thing to do. Athletes trying to make weight will resort to various techniques to drop unwanted pounds: diuretics, laxatives, exercise, fasting, self-induced vomiting, excessive sweating in the sauna, stimulants. Some athletes will lose 3 to 5% of their body weight in a couple of days. Kind of a silly thing to do, but I've seen all of these different techniques for college wrestlers and high school wrestlers. I thought it was silly. I was glad that I was a track man and didn't have to do those silly things. Anorexia and bulimia are not uncommon among athletes who are potentially trying to make unrealistic weight levels. Another problem with weight maintenance is the opposite of anorexia, muscle dysmorphia, where the individual becomes obsessed with muscle development as they see themselves as too weak whenever they look in the mirror. These individuals are more likely to take copious supplements and steroids to combat their body's weaknesses. Athletes will often use diuretics to lose weight rapidly, to limit the bloating caused by steroids, by sucking the water out of their system to avoid detection of their illegal drugs, to lose weight to look thinner. Athletes need to monitor their use of diuretics because of the possibility of dehydration leading to heat stroke and organ damage. Weightlifters will take adrenaline supplements combined with amyl or isobutyl nitrite to increase strength. It unfortunately can cause dizziness, rapid heartbeat, and hypertension. Bee pollen is sometimes taken as a supplement, a way of boosting energy levels, digestion, and reduce stress. Studies do not support any benefit from the bee pollen, but they do it anyway. Some athletes will take calcium pangamate as a supplement. This chemical combination is sometimes referred to as vitamin B15 and pangamic acid. It is reputed to keep muscle tissue better oxygenated, though there is no scientific research to back up the claim. This substance is a known carcinogen, so it sounds kind of silly to do that. Ciproheptadine or Periactin is reputed to be a steroid-like bodybuilder and has been used to increase body weight and muscle tension or strength. This drug is an antihistamine. It acts as a serotonin and histamine antagonist, and it increases muscle mass and strength by making the individual hungry. It actually merely increases the user's appetite and has the added side effect of decreased performance, sweating, and sedation. Periactin is found in, it's not sold in the United States. You have to go overseas to get it. And Thailand is notorious for Periactin. Whoops, I went the wrong way. Erythropoietin or Aranesp is a medication developed to treat chronic anemia. Just like erythropoietin, the drug increases your red blood cells and thus the oxygen carrying capacity of the athlete's blood. Human chorionic gonadotropin is the substance produced by fetuses to protect themselves from their mother's immune system. If you've ever had a pregnancy test, or if you know of anybody that's had a pregnancy test, what they were measuring was the human chorionic gonadotropin that the fetus was putting off. Probably at that point they were a zygote or an embryo, but that's what they were measuring, the HCG is human growth hormone. HCG, the human chorionic gonadotropin. HCG, along with clomiphene and tamoxifen, is taken by steroid users to restart their own body's testosterone production. This substance also blocks the increased effects of estrogen in the male body. The drug can have an impact on the liver and the reproductive system. Modafinil or Provigil acts as a stimulant and is used to treat narcolepsy. Athletes using the steroid THG will take the drug to mask the steroid. Ornithine and arginine are amino acids taken to increase muscle mass because it is reputed that they cause an abnormal release of HGH. Permagene is used in Europe to facilitate the release of steroids in the body. Vitamin B12 is used to ward off illnesses and provide extra energy. We used to give it to people when they're trying to recover from a hangover. They'd come into our clinic and we give them a shot of B12, which is red. It's red stuff. It's kind of cool. As has been seen, athletes will do just about anything and take just about anything to improve their performance on the athletic field. Athletes will use stimulants to boost their performance, from innocuous caffeine and tobacco to the more destructive amphetamines. Athletes will use sedative hypnotics, especially Xanax, to unwind from the stresses of competition. Sometimes these drugs are used to counteract the stimulants that they have taken to perform. The most widely used depressant by athletes is alcohol. While in low doses, the substance does not hinder performance. In most cases, alcohol is used as a reward for performance, as a way to unwind, or as a consolation after a disappointment. Marijuana is contraindicated for performance, though when used in the right mood might actually improve performance. Marijuana doesn't help athletes because it lowers your blood pressure, causing fainting during competition. It inhibits your sweating, which might lead to heat prostration during exercise. It decreases your tracking ability. It hinders the ability to do complex tasks. It diminishes your hand-eye coordination. It decreases oxygen intake. It is banned it's a banned substance by the NCAA. It is illegal in 36 of 50 states. Because marijuana is fat-soluble, it continues to impair 1 to 2 days after its use. And that is where we're going to stop. The reason we're stopping here is because this is a monster chapter, and I will finish the rest of it next week. So stay safe. I will see you next week. So be good.